Hello, my name is Dylan, and I'm the creative director here at Silicon Valley Orthopedics.
Hi, I'm Dr. Mossy Reynolds, orthopedic surgeon, sports medicine specialist, and co-founder of Silicon Valley Orthopedics.
And today we are here to talk about
Meniscus tears.
Dr. Mossy. What is a meniscus?
A meniscus is, well, we actually have two of them, one on the inside of our knee and one on the outside, medially and laterally. These are shock absorbers in the knee. They're cushions. Think about them like trampolines in our knee to help provide padding when we run, when we jump, when we cut, when we pivot. Yeah, little shock absorbers inside the knee.
That's cool. I didn't know we had little shock absorbers in the knee.
Yeah, how else do you think you can dunk?
That's true. I can dunk really well. How does one injure the meniscus?
Good question. The meniscus is very commonly injured inside the knee, typically with sports or activity, but it can happen just randomly. What it is, it's a load. It's a compression through the meniscus, and then it's a rotation. And sometimes you can catch the meniscus just like that, rotate across, and tear the meniscus.
Are there any other symptoms that one may present with?
A lot of times meniscus tears are associated with pain, and sometimes they're actually associated with mechanical symptoms. If they're bad enough, a piece of the meniscus can actually catch and flip into the joint. And so you can get this sort of what we call mechanical symptoms where you're getting catching and locking. Sometimes you can feel a little bulge on the knee, the swelling around the knee as well. And so sometimes you can get loss of motion.
If I'm feeling like I'm having that catching and locking feeling in my knee, how do we diagnose if it's a meniscus tear or not?
If you're having any of those symptoms, obviously come right in, we'll check it out. There are a few things that I and our team could do to try to evaluate to see if you had a meniscus tear. There's certain exam findings that we typically see, but honestly, most importantly is for us to get imaging of it. You know, there's nothing that replaces a good MRI or diagnostic imaging to evaluate that meniscus.
So once you have it diagnosed, how does one treat?
So there's so many different types of meniscus tears, and it really depends on the size, the location, and the characteristics of the tear itself. You can get what we call vertical tears of the meniscus. You can get radial tears that come across the meniscus. You can get horizontal tears that come underneath the meniscus. You can get bucket handles where it'll flip into the joint and lock. You can get root tears. So there's all kinds of meniscus tears that you can sustain. And some of them, unfortunately, are surgical, but a lot of them are non-operative. A lot of times we can rehab through and we can actually live with the meniscus. And if it's torn along the outside where the blood supply comes in, sometimes they actually can heal themselves. Some tears we can actually treat with what we call biologics, platelet-rich plasma, bone marrow aspirate concentrate. And unfortunately, sometimes we have to repair them. So arthroscopically, we have to go in and put stitches into that meniscus to hold it together.
It's nice to know that we have options when it comes to this.
You always have options.
Yeah. Well, what's next? Where do I go if I think that I tore my meniscus?
Yeah, come see us. We'll help you get squared away with an MRI, and we'll talk about all the options that you have. Just let us know how we can help.
Sweet. Awesome. Thank you.
No problem.
That was perfect. That was perfect. Yeah.
You can edit that one.